We are here to talk about a nutritional review in this webinar. The information that I'll share here is information that I did for many of my clients who were elderly, who had health concerns, chronic diseases, nutritional concerns. These are very good tips and a very good process for you to follow for yourself or for an elderly parent to make sure that you're looking at all aspects of that circle of care to minimize chronic diseases and the effect of chronic disease on everyday life. As always, you know what's next? Housekeeping. I substitute the term elderly parent or elderly parents for that person for whom you are caring for, whether you are a professional caring for clients or a family member or friend. The outline for the module is in the course materials. Print that out, print the slide handouts out, take notes, and learn along with me. Let's talk about the objectives for a nutritional review. At the end of a nutritional review, you should be able to initiate a doctor appointment for an elderly parent to request a nutritional evaluation. You should be able to reinforce the concept of how physical activity, depression, and medications can affect nutrition, and create that step-by-step plan to respond to dietary concerns. One of the most important steps is to talk to your parent. You have to get them to agree, to buy in. By now, you should have plenty of information from these webinars to notice poor nutrition in an elderly parent. You want to be proactive and make a doctor's appointment to talk about the nutrition status of your parent. But before that appointment, talk with your elderly parent, share the information that you have with mom or dad about how poor nutrition affects the body and physical activity, senses, smell, taste, vision, dental concerns, mood, and how they feel on a day-to-day basis. Gain mom or dad's agreement about the plan that you want to discuss with the doctor so that your parents will participate in the evaluation to identify nutritional concerns. Also, put mom or dad on the scale. Check their weight. Do you know if it's stable or if there have been changes? When you call to set the appointment, the doctor's office will ask the reason for an appointment. You don't want to say nutrition because if you say nutrition, they may not know how to respond. Instead, you can say that you are concerned that your elderly parent is more physically weak, there may be signs of depression, and all of this might be affecting mom or dad's appetite. Remember, we talked, nutritional concerns are not a normal part of work for primary care physicians. They're not trained in nutrition, but they are the person that you have to start with because the primary care physician is that gatekeeper to the specialist that you want to be able to see. In this case, we're starting at the beginning to be able to get the care that you want for an elderly parent through the specialist that you want to see. Talking to the doctor. So how do you approach the doctor about a nutrition review? The conversation goes something like this. Hey, I'm concerned that my mom or dad's nutrition is poor. They're not really eating well. Mom seems a little down these days and doesn't really have an appetite. You can also say, Mom and Dad are losing weight. They seem to be just getting physically weaker, and I'm worried that they're going to fall. The more specific you can be, the less emotional, the more direct, the better. Doctors need and want facts if they are to write an order for any kind of nutrition review, a depression screen, physical therapy, or a referral to a specialist. We want a medication review out of this. We probably want blood work to be done, and we want to look at any other concerns that might not be obvious. If your elderly parent has nutritional problems or is in that failure to thrive state, you definitely want to put together a team of healthcare providers to help you resolve these concerns, because sometimes it does take that team. As we discussed, nutritional concerns can relate to many areas: medications, mood or depression, the ability to perform activities of daily living, digestive problems, and chronic disease. I quoted some statistics throughout this program about the percentage of elderly adults who suffer from malnutrition. If you have to go to the extent of citing these statistics to your doctor, please do. As again, some primary care physicians just don't know how significant that is. And they may say, well, this is just what happens. Well, no, it's not. It's much more difficult for a doctor to argue with research and a list of specific factual concerns about your elderly parents. So here's how you go about requesting a medication review, which is the first review. So you want to talk about medications to see if any of those might be having an adverse effect on daily function, weight loss, mood, or memory. That medication review, it should be a review of chronic diseases, the effect of the illness on nutrition, and the prescriptions. You can ask if any of the prescriptions have adverse side effects on appetite or nutrition. After the physician reviews the medications, verify the information with your pharmacist also. You can also ask your pharmacist to review it to see if they have any other suggestions or concerns, knowing that nutrition and weight is a concern. Being thorough makes a big difference. You might be surprised by the knowledge and information that your pharmacist shares with you. They're a great resource, as we talked. Depression is another concern of low appetite, of not eating, and of other health concerns. So as we talked in the last part, our mood affects appetite. Ask the physician to evaluate mom or dad for depression. A review is traditionally completed. It uses an evaluation tool called the Geriatric Depression Scale, GDS. That's another medical speak term. The warning sign is that, an unskilled health provider who doesn't know a lot about depression may not know how to talk to your parents in a manner that they will respond honestly with concerns, or you may have to offer your observation. And I want to give an example of this because this happened with so many of my clients. So a lot of the elderly are just viewed as having depression. Elderly in nursing homes are depressed. In care communities, they're depressed. And the staff, in my opinion, gets a little biased or a little insensitive to the fact that, yes, someone is depressed. They just take it as, well, of course they're depressed. Why should we do anything about it? Everybody here is depressed. Sometimes the staff is depressed. So the geriatric depression scale is a very direct questioning. So I'm asking you, are you depressed? Well, you don't want to say yes. More than likely, you want to say no. But if I asked you, are there days when you don't feel like yourself? Are there days when you'd rather just stay in bed and pull the covers up over your head? Days when you don't have an appetite? Days when you feel a little down? I think a lot of us would probably say yes. Those are the types of questions that should be asked of elderly parents instead of the questions that are a yes or a no answer, because when in doubt, people say no. Your parents won't pass the depression screen. They will not get the treatment that they need. It takes a special person to work with elderly parents. It takes a special doctor to work with elderly patients, especially, and to diagnose these types of problems. Let's talk about that nutrition review. So your primary care physician hopefully will admit that he or she is not an expert in nutrition. There are screening tools like that geriatric depression scale that are used by registered dietitians to complete a nutritional-based physical exam. The tools are called Subjective Global Assessment and a Nutrition-Focused Physical Exam. Your best bet is to ask for a referral to see a registered dietitian. And I've included a copy of the Subjective Global Assessment in these materials so that you know what it looks like and you can be a little more prepared. The dietitian is a great resource. They will look at what your parent is eating, make a lot of good suggestions in how to change the diet and how to get more protein, foods that you should eat more of, foods that you should eat less of. Then we want to talk about specialist referrals. And we kind of touched on this a little earlier. So getting to see a registered dietitian takes a referral. If your parent is having any type of tummy, stomach issues, burping, indigestion, gas, diarrhea, constipation, ask for a referral to that person who is called a gastroenterologist. And, your doctor may be concerned that you're trying to manage all of this at once. But here's the thing. If your elderly parent is malnutritioned, or if they're in a failure to thrive state, you can't do too much. You cannot be too proactive because you've got to stop the decline. You've got to reverse the decline. Otherwise, you're going to have further issues. So request all the referrals, schedule them in order of priority. It's not like you need to see everybody at once, but gather the information, get the referrals, make your plan. So guess what? We're back to the subject of physical therapy. If you haven't gone to the doctor for any other reason, if you have not yet requested a physical therapy referral, now is the time. Because by now, you know that poor physical health, chronic disease, mobility issues relate to nutritional status. Here's where you offer the doctor information about what your parents can and cannot do. You'll actually surprise the doctor with this information. How many of you remember those exercises that we talked about? I'll give you a hint. Get out your pens. Can your elderly parent stand from a chair without holding onto anything? Walk 10 feet forward, return to the chair, and sit down within 10 seconds. If not, they may be a fall risk. Can they do the sit to stand exercises? Physical weakness in the legs, poor balance, and walking speed are concerns that identify fall risk in an elderly adult and their ability to remain at home without falling. If weakness or any type of physical concerns exist, participating in that physical therapy evaluation can have very positive results. And do you remember that catch-all question? What is it? Doctor, what question should I be asking you that I am not? This allows your doctor to be pleased that you're taking an interest and have a desire to be more proactive about the health of your elderly parents. They're more likely to make other suggestions to help you out. It's really a very positive thing to become engaged and interested in the health of your elderly parents. And honestly, not a lot of people do this. The doctors appreciate people who are proactive. Let's talk about protein supplements. In a lot of my clients, there were serious issues with physical weakness and low protein stores that were identified by blood tests, or they would have skin wounds. And so we had to do something to turn this around very quickly because, as you know, skin wounds, very serious, can result in death. So I would take them to dietitians. We would go to wound care doctors. We would go to specialists, gastroenterologists, trying to resolve all of this. So I know I mentioned this before, but if you look on the slide, there was a reminder to listen to that Caring Generation podcast. Dr. Nicholas Dutz talks about nutrition for elderly parents, and I talk more about activities of daily living and physical issues. So Dr. Dutz recommends whey protein supplements. You can go to any nutrition store like a GNC, Vitamin Cottage, vitamin stores that you have by you. It comes in a container, and it's powder. It's whey protein powder. So as long as your parent isn't allergic to whey protein, it's a great thing. You can put it in coffee, put it in milkshakes, put it in ice cream, sprinkle it on food. Dr. Dutz even suggested putting it in a Diet Coke. I don't know about that. I don't think I would like that. But we have to find ways to support nutrition for our elderly parents. There are also times when the body just needs that extra boost. So you've probably seen protein supplements in the stores like Ensure, Boost. There are also protein supplements online that you can find, and protein supplements that a lot of nursing homes or care communities will use. These are called Magic Cups. They go by the name of MedPass. ProStat is another name. Mostly you have to get these online. You can talk to your doctor about them, talk to the registered dietitian, a nutritionalist specialist, or the wound care doctor about any of these supplements. whatever you can do to get more protein into the diet of an elderly parent, highly, highly recommend it. You'll see positive results. Let's talk about vitamins, digestive enzymes, and probiotics. These are extra little boosts that can help your parents. Because of my experiences with aging clients who had a lot of significant health issues, I support vitamins, digestive enzymes, and probiotics. Many of the digestive problems that we talked about earlier result from difficulties in absorbing nutrition from food and absorbing medications. So even if your parent is eating protein, if the body can't absorb it, that protein isn't getting to where it needs to get. As we talked, digestive issues affect wanting to eat and the ability to maintain a steady weight. So if you take your elderly parent to a gastroenterologist or a nutritionist, ask questions about vitamins, digestive enzymes, and probiotics. Also, if you have blood work done, when it's tested, you can look at B12, calcium, vitamin D, and proteins can show deficiencies. At a minimum, a senior vitamin can be beneficial. You can find digestive enzymes in-store and online. Those support the digestion of food and the absorption of medication, so your elderly parent will do better. Probiotics are things that help stomach health. Very good when somebody's taking antibiotics. The health of the stomach has a special term. It's called the gut microbiome. That's medical speak. There's a lot of research going on throughout the world and currently about this microbiome and the fact that our gut, our stomach, affect a lot of health issues with our body, including our mood. Gut microbiome is related now to schizophrenia and other health issues. So again, going back to this nutritional assessment, it really is good for anybody over the age of 50. Our bodies change, our nutritional needs change. Being proactive to stay healthy can prevent, as we know, so many of these health conditions. So appetite stimulants. This is kind of what I call the last resort, but it has been an important resort for many of my clients who suffered chronic health conditions, who because of the health condition and other medications they were taking, didn't have an appetite. They didn't want to eat. My goal was not to let my clients starve to death or have more nutritional issues because of medications that were trying to help them. So I really call this a last resort because your physicians are not going to want to do this unless conditions are extreme or unless you can be very factual about why you should do this. Okay, so I'm warning you up front, probably going to be met with, I don't know that would be good. I don't think we should do it. You're going to have to push it. You're going to have to be the one to say, yes, we want to try this. So the goal of this is to talk about nutrition by food, protein supplements, however you have to do it. There are medications that can increase appetite when a person has no appetite. And again, doctors don't like to consider these medications unless you can provide a good reason. And reasons would be like depression, side effects from other medications. You've been adding protein to their diet and their tummies get full and they just can't eat enough. But for example, people who are going through chemotherapy treatment, people who have cancer, a lot of times appetite stimulants are prescribed for them. And other medical procedures and conditions might also have similar needs. So let me grab a pen. I'm going to give you some of the names of these medications and you can ask about them. So one is called Megace. It's called Megestrol acetate. Another one is called Reglan, and that is metoclopramide. And Marinol, which is, and this one I got a tongue twister to pronounce, it's dronabinol. Your doctor may or may not be willing to consider these, even if only temporary. You may have to do a little bit of negotiation with your doctor if they disagree with you, but truly, if you are your parent's caregiver, If you have that legal responsibility of being the medical power of attorney or a court-appointed guardian, this really is up to you to make it happen. And as we know, depending on what state you live in the United States, marijuana can be purchased. Your elderly parents may or may not like this idea. If you're going to try that, be sure that you discuss it with them. Don't just give your parents a marijuana type product, a food product, or a snack that contains marijuana and the CBD properties. You want to make sure that they know it, but marijuana is a good appetite stimulant. We know this. We know this from people who smoke or ingest it, saying that they have the munchies. People who get the munchies who have used marijuana tell me that sometimes they just want to eat an entire cake. They'll eat an entire box of cookies. They will do whatever it takes because they have that appetite stimulant. So that could be the very last resort that you use. Obviously, it's a personal decision. It's up to you. If you do it, make sure that your doctor knows that you are doing it. So, summary for a nutritional review. All of these steps should help you rationalize how to request your primary care physician to order a nutritional review and a referral to a dietitian or a nutritionist or other specialists. Then you can put together a plan, a step-by-step plan to manage nutritional concerns for an elderly parent that honestly should show a marked improvement in their health and their well-being, not immediately, so not in a couple of days, not in a couple of weeks, over a period of weeks and months. You should see your parent gain weight, feel better, be digesting their foods, having less tummy issues, having more energy, having their skin look better, because remember, everything that we eat comes out of our pores and it is our physical appearance to others. I'm Pamela D Wilson. Please use these steps in the nutritional review to improve your health and the health of elderly parents. I will see you again in another webinar.